is opioid treatment, is it segregated by race and income? Do minorities and the poor have more trouble getting treatment and care than other folks? You're nodding, Dr. Cunningham.
Right, so I work in the South Bronx, and my patient population is 99% people of color. I've been doing this for 20 years. This is not new there. This is new, I think, in suburbs and rural America and in white populations. And really, our response has been different. I mean, I think it's great that we're up here talking about this and really what we need, but this is not new. What I would say is a couple of things. A lot of the traditional treatment centers are in communities of color. So those are the methadone clinics, right? And they are effective, but they are in the communities of color for the most part. I think when buprenorphine came out, this provided a lot more opportunity to provide treatment in a widespread communities. So now we can really provide it in any setting because it can be because of the limited regulations around it. But a lot of the problems that we've seen have to do with prescription opioids. And what we do know from data is that communities of color have actually have had disparities in care and were less likely to be prescribed opioids. So if you take that and you look at what the data show now, which is that deaths that are opioid related are much higher in whites than in people of color, a lot of that is because of the prescription opioid issue. And in fact, the disparities in people of color have actually been protective. In addition, because the methadone clinics have been in communities of color, there has been access to treatment more in communities of color. So this is an interesting phenomenon where the disparities in care have actually been protective for people of color, and the sort of, more widespread prescription opioids have actually hurt the white population.
I do think that we have to acknowledge that for particularly communities of color, our response historically has been an overwhelming criminal justice response. That people in our jails and prisons, largely people of color, are there because of. So part of our reform is not just healthcare system reform, but criminal justice reform. So we've got to think about how do we divert people away from our jails and prisons in the first place? How do we make sure that people in jails and prisons are getting good evidence-based treatment and that we're getting them good reentry services on the way out? Data that Massachusetts has put together shows that those that are coming out of our correctional facilities are at 120 times the risk of an overdose. But we've seen good models. So Rhode Island actually did this very interesting study where they looked at getting people in our jails and prisons on a medication-assisted treatment.
Can you explain for folks why that is, the 120 times?
Sure. So one of the things that we know is, one, people who are in our jails and prisons don't often have access to any treatment at all, but particularly medication-assisted treatment. And we know that you're at heightened risk for an overdose when you go through a period of not using. And then you start using again at the same level. So your tolerance is way down. And that's where your risk goes way up. And that clearly is borne out in the Chapter 55 data that we have here in Massachusetts. Mm-hmm. So part of this is how do we start and get people on good medication-assisted treatment and then transition them to the community so that there's no interruption in care.
Keep them on it.
Keep them on.
And the good news is that in the commission report, we recommended that drug courts be implemented in all 96 federal courts so that we can expand it. When I served as deputy drug czar in the country, what I found is that drug courts serve less than 10% of the people who would be eligible for it. And a drug court essentially gives you a choice of treatment or prison. And I think this is a much more humane way of dealing with people who have felony convictions and also have an addiction. We also recommended in the commission report that there be treatment in our prison system so that people do not come out tolerant, with loss of tolerance to opioids and then die within weeks or a few months of release from prison. We also recommended a number of steps to take on release of prison to help individuals gain a restoration of their hope, their employment, their communities, and recovery housing for them. So the commission did deal quite extensively with the prison population or the population that's involved with the criminal justice system.